Okay, so let's talk about celiac disease and CD122. And there's two companies we're going to focus on, Forte Biosciences and anaptysBio. And celiac disease is a fairly common disease, and people get a lot of GI symptoms from that. You have to go on a gluten-free diet. Those little villi in the small intestine get inflamed, and they actually kind of disappear if you do a biopsy of the small intestine. So there are some blood tests for celiac disease: tissue transglutaminase, IgA antibodies, and you also check a total immunoglobulin A level to rule out IgA deficiency. That's probably the main blood test that's done. There are a number of other blood tests that can be done, but bottom line is, if you're not sure, you can proceed with a duodenal biopsy. So the CD122 antibody from Forte blocks both interleukin-2 and interleukin-15. So the idea is to decrease inflammation. And anaptysBio also has a CD122 antibody. So the antibody from Forte, again, it's designed to lower the interleukin-2 and interleukin-15 levels, which should help inflammation in the gut if there's gluten there. And how do you give it? Well, you can give it by intravenous or subcutaneous route, but the subcutaneous route is obviously easier than IV, and that'll be the long-term solution. It not only knocks down interleukin-2 and interleukin-15, but it also does not inhibit Treg proliferation, and that's important from an immune standpoint. So they're actually looking at 4 different drugs over at Forte for this CD122 antibody: celiac, vitiligo, alopecia areata, and type 1 diabetes. So they did a phase 1b study in celiac disease where they basically gave some shots of the CD122 antibody followed by a gluten challenge, and then a small bowel biopsy. And you can see from the symptoms at the time of the gluten challenge that people did better if they had had shots of the CD122 antibody. And a phase 2 design is planned, and it should start in 2026. And it'll be a similar type of thing where you get the shots followed by a gluten challenge and then a small bowel biopsy at the end of the study. Now, vitiligo is another autoimmune disease where you lose the pigmentation on your skin. Instead of being dark, it's rather light. And they think that that drug might actually help vitiligo. And there's a picture of my hands, and I actually have vitiligo. You can see the white areas there where the melanocytes have been killed by the immune cells. Also, alopecia areata is an autoimmune condition. That's where you lose little circles of hair on the top of your head. Really annoying for some people. And a serious disease, very early type 1 diabetes. They think that the CD122 antibody might actually help if you gave it very early in type 1 diabetes, at least help to delay the onset of the disease. There are a couple of drugs that are available now, but they're kind of hard to take, like the Tzield. You have to take an IV infusion once a day for 14 consecutive days. The other drug requires hospitalization. So there does seem to be some help on early type 1 diabetes for delaying the onset, although eventually the type 1 diabetes will win and people will have to go on insulin. So for anaptysBio, that's the second company we're going to talk about with a CD122 antibody. That actually will be splitting into two separate companies. One will be a biopharma company and the other one will be a royalty company. And that will probably happen in 2026 here. So anaptysBio is working on celiac disease and also esophageal eosinophilic esophagitis, which is another autoimmune type disease. And again, you can see that by blocking the CD122, you're blocking both interleukin 15 and interleukin 2 to try to decrease that inflammation. And again, here's a picture showing that. And there are some companies that just work on interleukin 15 alone and don't work on both. For example, if you look at Teva there, in the middle, they work on interleukin 15, but they don't work on interleukin 2, whereas the two companies we're focusing on work on both interleukin 15 and 2. And in this study, it actually looked like the ANB033 did a little bit better than the forte drug. And if you look over on the right side here, there was gluten plus the anti-CD122 antibody, and it looks like the antibody protected those villi from inflammation. So this gives you an idea of how common this celiac disease is, and also a lot of people will respond to diet and might not need any further treatment other than a gluten-free diet. But some people don't respond, so that's where this drug might help. anaptysBio also is going to be working, as I mentioned, on esophageal eosinophilia and along with the celiac disease. So bottom line, we have two companies working on antibodies against CD122 for celiac disease, forte and anaptysBio. Hoping for good results in the future. This is Stephen Vig in San Antonio. Thanks for watching.